Welcome to the Gensupen2 User's Manual. Dear user, this short video shows you how to use the automatic insulin pen injector Gensupen2. Gensupen2 is intended for use exclusively with standard 3 ml Gensulin insulin cartridges manufactured by Bioto. Gensupen2 is a multiple-use pen injector. It provides the patient with a precise, safe and convenient way to administer the insulin doses recommended by the doctor in the range of 1 to 60 units, in increments of 1 unit. The automatic insulin pen injector Gensupen allows for a constant speed of insulin injection, regardless of the selected dose. Preparation of the Gensupen pen and insulin. Wash your hands before using the pen. Unscrew the cartridge holder from the Gensupen pen body by turning it counterclockwise. If the plunger is pulled out, press it into the pen body. Insert the insulin cartridge into the cartridge holder, rubber tip to the front. Attach the cartridge holder to the pen body by turning it clockwise to hear the click. Check the injector with the insulin cartridge to make sure it includes the right insulin type. If you use Gensulin N or premix Gensulin form, for example Gensulin M30, you must mix the insulin in the pen cartridge. According to the insulin summary of product characteristics, Gensupen with inserted insulin cartridge should be rotated in the palms of the hands 10 times and inverted 10 times to obtain uniformly cloudy or milky suspension. If not, repeat the above steps until all ingredients are mixed. Do not shake the injector, as this may cause frothing, which may interfere with the correct preparation of the dose. Now Gensupen is ready for the needle attachment. There are different needle sizes available on the market. The length and diameter of the needle that best suit your needs should be determined during your conversation with a nurse or a doctor. Peel away the paper covering the needle. Attach a new needle onto the cartridge holder by turning it clockwise. Remove the outer shield of the needle, the bigger cap. Keep it in order to remove the needle after injection. Remove another inner shield of the needle. Before insulin injection, you need to remove air from cartridge and needle tip. To do so, using the dose selector of Gensupen, choose 2 testing units of insulin. In order to do this, turn the dose selector clockwise until number 2 appears, which corresponds to the desired dose of 2 units. Hold the pen with the needle facing upwards. Using your thumb, slide the trigger in the direction of the needle. Hold the trigger until a green dot appears in the window, signaling the end of the injection. A drop of insulin should appear at the end of the needle. If a drop of insulin does not appear, select 2 testing units again and again prime the pen. In order to select the amount of insulin you want to inject, turn the dose selector clockwise until you see the desired number or mark corresponding to the number of insulin units you want to inject. If you have chosen a dose that is too high, you can easily reduce it. Rotate the dose selector counterclockwise until the desired dose appears in the dose selector window. The audible clicks have a different distinctive sound. Check if an appropriate number of insulin units is visible in the Gensupen dose selector window. Now take the Gensupen injector in your hand, with your thumb comfortably on the trigger and the rest of your fingers holding the pen. Then insert the end of the needle into the subcutaneous tissue. It is recommended to insert the needle into the subcutaneous tissue at 90 degrees into a formed skin fold. Using your thumb, slide the pen trigger in the direction of the needle. The insulin is administered smoothly with the constant speed. Hold the trigger until a green dot appears in the window signalizing the end of injection. Count at least to 10 and remove the needle. If the green dot didn't appear, it means that there is no more insulin in the cartridge. Remember the number of units you see in the Gensupen selector window. It corresponds to the number of units of insulin which you must select to complete the injection. After the injection, put the outer needle shield on the needle. Then rotate the outer needle shield counterclockwise. Remove the used needle. You've completed your insulin injection. Do not massage the injection site after the injection. The recommended subcutaneous injection sites are abdomen, buttocks, thighs, or upper arms. Rotate insulin injection sites to avoid thickening. Choose different injection sites within one body region to avoid using one site more than once a month. Thank you for watching the Gensupen2 User's Manual.